In this episode, what we're going to do is look at the current ways of using nicotine replacement therapy in smoking cessation. And this will lead us to Series 3, which will talk about where e-cigarettes fit in the new algorithms. I'm John Shaske, a clinical pharmacist for the last 40 years, currently clinical instructor at the University of British Columbia. I have won several awards, both provincially and federally, on innovation, and as well an award for Agent of Change from the University of British Columbia. Welcome to Series 2, Episode 3, comparing nicotine products and methods to smoking cessation. So now let's talk about nicotine replacement therapy. Originally, when the patches and the gum came out, it was very clear to only use the patches and quit smoking immediately before. You could not have anything more than one 21 milligram patch on at any one time. However, by 2016, research, particularly from Great Britain, showed it was better to use the rule of thumb that for every cigarette you smoke per day, that equaled 1 milligram on the patch usage. So if you smoked about 10 a day, just start with a 7 milligram patch. However, if you were at about 20 a day, which the average smoker's at, you use a 21 milligram patch. However, if you're a 2 a day pack smoker, there is no problem at all with now using 2 patches at the same time. In the past, it was forbidden to have that cigarette with the patch on. Now it's even considered normal to start the patch at a lower level and start to reduce the number of cigarettes that you're smoking. And you can do that by, number one, picking a quit date such as 2 weeks in advance, or what I prefer to do a little bit more is do it patient-driven, and that is to let them decide through quick meetings that I have with them how they're doing at that time. They may be over-exuberant in their thinking of when they can actually stop, and then something comes up, such as a stressful exam, problems at home or work, or whatever it happens to be. So we have to be very aware of that and tailor-make it every time we meet with them rather than setting to a schedule, although you can put some creative tension, shall we say, on things by pushing them along. I then also utilize the short-acting products, and I particularly like to recommend the gum, as long as it's appropriate for people, because of course with dentures and stuff, maybe one of the lozenges might be better. But normally the gum, the idea is to minimize those cravings and get out of the habit of smoking, and then start to reduce the amount of nicotine that they're dependent on. And if it takes 3 months or 6 months or 9 months, it doesn't matter. But usually between 6 and 9, I like to make sure they're not smoking any cigarettes whatsoever and that they are on the road to reducing their number of patches to 0 by 1 year. I've had people actually successful in 3 months and never have a cigarette again. And I've had others that have cycled back where I just tell them, use it as a learning experience and continue on from there. I also teach them about other things that they can do, such as exercise, rewarding themselves when they are successful, and of course there's always the handling and fiddling things with the cigarettes that they are now going to miss, and get them to replace that with things like carrot sticks, celery sticks, sometimes cinnamon sticks, whatever they will need to use. Sometimes it's just a simple pen, other times it's very difficult, and this is a place where nicotine replacement through e-cigarettes might be a useful way to do things. Click on the like button and subscribe button. If you have any comments or questions, please leave them in the box below. As always, thanks for listening, and I look forward to seeing you in the next episode.